Hi, just wanted to say, don't let the media scare you about the proposed new health care plan. Medicare is a government-run health care plan, and the seniors love it. You can only get Medicare if you're 65 or older, and when seniors get into the Medicare program, they love it. They don't even consider that it's government-run. They get all their services. They love everything about it. They do have to get gap insurance, and there is a problem with pharmaceuticals, but the new healthcare plan proposed by Obama will also negotiate as a group for all of us to lower medication costs. If you know any seniors, you can ask them about the cost of their medications, and they can tell you they're horrendous. There are some policies they can get to lower them, and some stores such as Walgreens and Walmart do offer lowered monthly plans for seniors and their medications. But the Obama proposal for health care will also negotiate for lower medication costs, and that is a plus. We must remember that insurance companies who provide health insurance are corporations, just like any other corporation. They have stockholders, and those stockholders want profits. So they are not interested in being caregivers. They're not interested in your health. They just want the corporation to be successful. Most of the people who are stockholders in corporations are not individuals like your mom, your aunt, or somebody like that. They're hedge funds. They're big funds. They're very impersonal. They're businesses, and they want profits. They are not interested in sob stories about your health or your dying or your need for a kidney transplant or something like that. So having an insurance company decide whether or not you are going to get health care is very bad. One of the scare tactics they're using is saying don't put the government between the patient and the doctor. Well, currently you have a corporation between the patient and the doctor, and the corporation does not give a hoot about your sob story. So as in Medicare, where the government is between the patient and the doctor, the Medicare patients are getting good care, and you can ask any senior you want. They are very happy with their Medicare coverage. So the thing to remember is that the insurance industry is run as a corporation. It is run for profit. The people who invest in the corporation are other corporations, other big businesses. They're very impersonal. They're working for profits. They're not working for you. The reason they are so interested in getting the American public to denounce President Obama's health care plan is because if you denounce it, people will have to come to the private insurance companies and pay those high monthly premiums, and so it's a growth technique. If you denounce President Obama's health care plan, you will have to go to the private insurance companies, and they will be able to offer you insurance at high rates. The other thing they do, and this happened with Aetna, they bought up a whole lot of various insurance companies, and so they had like millions of people. They had too many people. So they brought in a specialist who went through the names and backgrounds of each of these people. Remember, when you're with a health insurance company, they know all about your health and every illness and every use you make of that medical policy. They go through and they find out people who are using the policy too much or who have illnesses which will in the future cost more, and then they weeded out 8 million people. They told 8 million people they were not going to continue them under Aetna coverage, and they were dropped. They were purged from the Aetna line, and it makes more sense for them to get rid of people who have illnesses or who are headed towards a major illness or who are using their coverage too much than to keep them. And once they dropped these people, they soared in the stock market. because they got rid of their expenses. And when you get rid of your expenses, your profits soar. So Aetna's profit soared because they got rid of 8 million people who needed health insurance. Where are those people? They're among the uninsured. If they had pre-existing conditions, they weren't able to pick up insurance, and that is part of President Obama's plan. Once you are diagnosed with a illness, you cannot be purged, you cannot be thrown out of an insurance system just because you have been given a health diagnosis. That's one of the problems. We can diagnose things easily. Some of the things we even diagnose as when people are infants or even in the womb. So once you have one of these diagnoses, no matter how young you are, you right now under the current system and under the private insurance system, you will not be able to get insurance because you're high risk.